video tutorial draws together the 3 lines of study in Workstream 2 on the impact of economic recessions on drug use, developed as part of the EC-funded project LEADER, which stands for Looking at Economic Analyses of Drugs and Economic Recession. In this tutorial, Gera Nagelhout from Maastricht University will outline the conclusions that can be drawn from LEADER Workstream 2 on economic recessions, what recommendations the LEADER scientists put forward for research, and the recommendations for policy to address drug use in times of economic crises.
Several conclusions and implications can be drawn, combining the findings of the literature review, the client reality check, and the regression analysis in the LEADER workstream on economic recession. Both the findings from the literature review and the client reality check suggest that illegal drug use may increase after the start of an economic recession. Possible mechanisms are an increase in psychological distress and an increase in non-working time after people lose their job. Both can lead to an increase in illegal drug use. The dominant mechanism from the literature review for alcohol use was a decrease in income after the start of an economic recession, which can lead to a decrease in alcohol use. This was in line with the main finding from the regression analysis of aggregate level data from 28 European countries, in which we found that increases in unemployment were associated with a reduction in deaths from alcohol. Tobacco use was only examined in the literature review, and we found both mechanisms that increased and decreased use. We have quite a few recommendations for research, as we found many areas in which research on the impacts of economic recessions on substance use is lacking. First of all, future research should report on subgroup differences when examining the impact of economic recessions on substance use. Similarly, studies should distinguish between different substance use outcomes, for example, initiation, cessation, reduction, or use of different types of illegal drugs. These results are relevant when considering interventions to reduce possible negative effects of economic recessions on substance use. Future research should also examine individual-level mechanisms that have been hypothesized to partly explain the impact of economic recessions on substance use, but have not been studied with empirical data. Moreover, a literature review of evidence for population-level mechanisms could increase our understanding of how economic recessions affect substance use. Furthermore, studies on the impact of economic recessions on the use of new psychoactive drugs or designer drugs are needed. More research is also needed about the extent to which economic recessions impact on resourcing substance use prevention programs and substance use treatment services, and on policies and programs that may be able to mitigate any negative impact of economic recessions on substance use. An important challenge in research concerns the use of aggregate versus individual level indicators. We have examined aggregate changes and individual level mechanisms in separate studies. Future work should try to combine these. Finally, aggregate data on unemployment and drugs and alcohol-related mortality should be routinely collected without missing data. Additionally, survey data on use of illegal drugs and alcohol should ideally be collected on a yearly basis. Because there are so many gaps in existing research, it is quite difficult to formulate evidence-based recommendations for practice. So we only have a few recommendations for practice that are very obvious from our findings. First of all, social policies to promote employment and treat psychological distress in drug users are warranted, particularly during an economic recession. Health professionals should be mindful of the risk of increased alcohol use among men due to increased psychological distress during an economic recession. Furthermore, patients in addiction treatment should be made aware of social aids, such as economic aids and social housing. Results from the client reality check suggested that patients are not very well aware of this, but it should be noted that these results may not be representative of all patients in addiction treatment. Finally, vulnerable groups such as people with a low socioeconomic status should be protected to ensure universal health coverage in times of economic recession. And cost-cutting measures in the health sector should not increase socioeconomic inequalities in health. A detailed account of the 3 lines of research and reference lists can be found in the full report on the LEADER project website.
LEADER Deliverable 2.1, a report on the impact of economic crises on illegal drug use, as well as other project inputs, are available for download from the LEADER project website at www.leader-project.net. LEADER video tutorials are also available, giving an overview of the LEADER guidance for estimating social costs of illegal drug use.